Hey guys, welcome back to Father and Son Investing. I've been getting several comments requesting some updates on what's happening with Nanox and what my opinion is, asking whether I still hold the stock. Well, I want to start today with what I think is the most exciting thing happening with Nanox in the recent months since my last video, and that is a merger and acquisition, particularly Zebra Medical. I think that this is one that adds a lot of bang for the buck for Nanox. Zebra Medical is a startup company in Israel that focuses on artificial intelligence and what it can bring to the radiology sphere. Stay tuned. All right, Zebra Medical Vision. As I mentioned, it is a startup artificial intelligence company founded in Israel. Interestingly, one of its co-founders was hospitalized in a small medical facility in Mexico after a diving accident. The facility had excellent medical imaging available to them, but no one to actually read the images. And so this co-founder got the idea of why not employ artificial intelligence to medical imaging and being able to speed both the diagnosis as well as enable diagnoses which would otherwise go unnoticed. And so he and his co-founder developed Zebra Medical Imaging. The name for the company is also quite interesting. In medical school, the saying says, when you hear hoofbeats, think horses, not zebras.
When you hear hooves, you think horses, not zebras.
At least in the United States and other areas that don't have zebras, horses will be much more common. Nevertheless, the zebras still exist. Zebras in the medical lingo then are diseases which are more rare or less commonly seen, and thus much less likely to be diagnosed. Nevertheless, they still exist. This company then decided that they would concentrate or at least help find the zebras. Now, the way that they're doing that, in part, is by taking the reports of thousands of radiologists. You know, when you're reading an image and you see something like a pneumothorax, and that gets documented in a report, the company then can retrospectively go back and find all of the reports that say pneumothorax and then start to look for the footprint of what those look like digitally. Since most imaging now is done digitally, they can find that footprint within the image and then teach their computer to recognize that same footprint so that it can be used proactively or prospectively for images that it hasn't seen yet. Now, that works great for emergency situations, but AI can be applied to many more things than just emergencies. This can drill down into reports and find terms that can affect population health, such as osteoporosis or coronary artery calcium, and learn to diagnose those same conditions as well. So this, for example, the company has published a paper talking about deep learning-based systems for Agatston score. That is the score that we use to say how much calcium a person has in their coronary arteries, and that can be predictive of future cardiac events. Now, usually those kinds of scans are run on cardiac CT, which is a particular algorithm for scanning the patient, and then computers, actually oftentimes it's radiologists, go in and pick the calcium within the coronary arteries, and then the computer sums up a total and gives a score. What if a computer could do that on just a routine chest CT? Now, that would be something that could add a lot of value to the healthcare system. Instead of having to bring a patient in for a cardiac CT, anytime they had a chest CT done for, say, a lung nodule, or they were in an accident, just any time, this algorithm could potentially pick up the coronary artery calcium and provide a score. Now, that adds a lot of benefit. Imagine you've gone in for your lung nodule and they also tell you, oh, by the way, you have this very elevated calcium score. Right now, that's just done kind of on a small, medium, or large amount subjectively by the radiologist on a routine chest CT. This here is also an interesting study that they did. So again, they used their deep learning technology to scan the reports of radiologists. They came up with the 40 most prevalent pathologies seen on a chest x-ray. Then they took 12 of those. They then took those 12 diagnoses using their model and compared that to a team of radiologists, and they actually showed that in most cases the radiologists agreed on average with the algorithm more than they agreed with each other. Now, this one is perhaps the most important for this company because it has actually received approval by the AMA, the American Medical Association, for a CPT code. Those are the codes that providers use to bill, and insurance companies then will look for those CPT codes in order to reimburse a provider for what was performed. What this algorithm can do is take a routine CT scan of, say, an abdomen or a pelvis. Those images can be reformatted in a sagittal direction such that this is what a person's spine might look like if you were looking at them from the side. It then can analyze this data and create what is a simulated T-score. Now, most people, when they go to have an osteoporosis screen, they get what's called a DEXA scan, and that generates a T-score, which gives you a relative value of what your spine looks like compared to a healthy population. This algorithm then will kick out a T-score number, and based on that number, say whether a person has a normal bone mineral density, has osteopenia, which means that they're lacking some of their bone mineral density, or has osteoporosis. People who have osteoporosis are at increased risk for major fractures. They then compared their algorithm and their AI T-score to the T-scores of people who actually had these DEXA scans. And what they came up with was that it had an 82% accuracy rate, meaning 82% of the people who actually have osteoporosis or osteopenia, this algorithm could detect that. Now, there's so much more I could tell you about this company, but I don't want to bore you with the details, but it is fascinating. Now, in terms of the merger, the buyout acquisition of this company, it's going to be potentially a $200 million deal. There will be $100 million up front with another $100 million that can be payable when certain milestones are met. Now, another important thing to know about Zebra is some of its credentials. Who else has been investing in this company? Well, you will see some well-known companies such as NVIDIA and Johnson & Johnson, and you have some other ones here. Intermountain Investment Fund, that's part of Intermountain Healthcare, which is one of the major healthcare companies out in the western part of the United States. Now, one more important thing to know about Zebra Medical Vision is that they are well versed in gaining FDA clearance for their products. Even on August 12th of 2020, they announced the 7th FDA clearance for an orthopedic surgery planning device. We look back a little bit further. They received an FDA clearance in oncology for early detection of breast cancer in mammograms. They are well versed in this. There we go, 5th vertebral compression fracture AI solution, which I talked about with you. So I think that Nanox picks up people within its organization now who are well versed in getting clearances from the FDA, and they also get somebody who has worked with the AMA to get CPT codes. We'll wrap this up just by showing you a list of their customers and partners. These are companies that are well known in medical imaging or in the IT space. My overall take on this is that this is a win for Nanox. I think Zebra Medical, while they are not the only AI company out there, they certainly have established themselves in this area, and I think that they will continue to produce products which are meaningfully useful in emergent situations and in the population health situations. Tomorrow we'll talk about Nanox's acquisition or potential acquisition. They have a letter of intent to acquire USA Rad. That is a group of radiologists, about 300 radiologists, and we'll talk about that acquisition. And the following day, we'll talk about Nanox and the 510 FDA clearance and how that is going. Until next time, enjoy your investing.